All right, now we're going to show you this little nice little holder here. It's called a Rin Unigrip. So this one is used for everything. The center piece will move for whatever you need it to be. So if you can see, there's red line, yellow line, and then Professor Monk has it on the blue line right now. You can see where the blue is, okay? So first you're gonna set it up like the anterior, and then she's gonna put it on her sensor. The back comes off. You just peel that off. And you wanna stick this right in the center of your sensor. So she's gonna put it right in the center. Go. Perfect. And then these little wings just flip over to hold it.
Give it a hug.
Give it a hug. And this is nice because it keeps your barrier kind of in place also. Okay. There's what we have. So now we're ready. She's got her tab ready for the anteriors. Now the key with this is, one of the things about this Unigrip is the bite block is kind of long. And also too, you don't want to have the patient bite down very hard because the bite block will slide up or down and move out of where you want it to be. So you have to make sure that the patient doesn't bite too hard. Remember, the patient is only closing to hold where you place the sensor. So we're going to do the maxillary centrals. Patient's going to open, we put it in. Just like we did with the bisecting holder. So she's placing it in, the patient just bites down or closes down gently. Okay. And there we go. So now your guide for this is your tab is at the bottom of your sensor. So your cone needs to have that tab at the bottom. You can see right there. And you notice how Professor Monk kind of uses both hands to kind of line up. She's lining it up, making sure the sensor's in. There we go. Okay, so then you would just move it to your canine laterals and move it across. All right, let's do a posterior, Professor Monk. Okay, so now posterior, she's going to turn, she's going to turn her little tab and slide it over so that she can do the posterior. Let me see again. Yeah. So we were here. There we go. So now she's going to go to those yellow marks right there, and she puts it down. And now notice she's all the way at the bottom there. We want to make sure we're at the bottom of where that plastic white is. Perfect. Okay. So same idea. We're going to go in the mouth. Don't have your patient close very hard. You're going to hold that tab and go in. Here we go. So see how she's holding that tab? She's getting her placement where she wants to be. Then the patient is just going to close nice and easy till they hold that. Okay? So you can see the sensor in there. You can see it in there, the angle. So now she's going to come with her PID. Bottom of the sensor is right there. She's lining it up, making sure that white tab is in the center of her cone. There you go. So it's bisecting, it's just with a different holder. All right? Yep. And then she can take it out. And then for bite wings, we'll just show you how to set it up. So bite wings is going to be the red all the way across. And she's just going to put it right in the center. And there's your bite wing. Okay? And this is nice because you got a little bit more to hold on to when you're placing it. There we go. There's your bite wing. So it's just like your tab. It's just a little bit longer. All right. That's called your Unigrip. Unigrip.